So we want to hit the main categories on day 2. So remember the big categories on day 2 after the initial bonding and rapport. You go immediately into big questions, big topics. What are the big topics? Time and money. Immediately. Remember, time and money happens real fast. You got to be real clean, real crisp, real sharp. So we go right into time. So we're going to confirm what the x-rays showed, what their problem was. That's the first thing they want to know when they come back. What did those x-rays show? That's what goes on the board first after, the howdy doodies. So that's what they should be hearing first. Remember, we're following the flow chart. What's my problem? Can you help? How long is it going to take to feel better? How much is it going to cost? That's the flow chart that we're answering to different degrees. So we did take a look at your x-rays. They do confirm you have X. So now we've totally nailed the problem 100%. That's what they want to know. What those x-rays show. Okay. Soon as you said that, immediately they want to know, again, we go into confirm to a large percent. It's not going to be 100%. Remember on day 2, we told them we could help them, but it'd be dependent on what the x-ray showed. So we probably answered it like 50% on day 1 or to maybe 70%. Now we'll probably be up to 70, 80% because we're going to ask for 3 days to see how they respond to care. But we're still answering the questions in order, and we keep answering more of the question. It's stair-stepping. Everything's about stair-stepping in relationships. No paradigm shifts. Okay, so then we go from your problem. This is your problem. We'll definitely be able to help. Then we go into how long it would take. That's the question. But before we ask for a commitment, we got to come back to money. So with your type of coverage, it costs X amount of money. Would that work for you? By the way, you did get a 20% discount if you pay for the next 3 days. Good. That usually is never a problem and goes over real well. And then you come back and confirm the 3 days. Because remember, we don't ask them to commit when we first covered it because money's not certain. So once they understand the money, then we ask for the 3 days. Will that work for you? Okay, so that's where we get time. So it happens real fast, confirming the problem. Yes, we can help. How long is it going to take, and how much it's going to cost. All of that happens, like within 2 minutes. You got major topics happening fast. Okay, now, and they should be that way. They should be crystal clean, crystal clear, crisp, and agreements along immediate. Boom, boom, boom. Okay. Then from there, we go into patient education. Remember, that's what they want answered when they come in. They don't want to hear patient education right away. So the order that you give information is vital. Vital. You do not want to mix this up. Now we can go into patient education. And this is when we go into the woods a little bit, go into greater detail with high specificity, and of course hit some major topics. So what's the major topics? What pleasure, logic, fear? Of course, the big topic there is what are the negative consequences that happen? What are you going to do to stop those consequences from happening? And what happens? What's the potential consequences if they stay permanent? And remember, that's the single greatest motivation. That's why you want to be unbelievably good when you get to that permanency phrase. That's the highest. There's a lot of different degrees of motivators, you do along the way. Consultation, parts of the consultation are more important than others. The talk-tell exam, touching the problem, all these things help create awareness and need and motivation. But there is nothing that tops that, the permanency of the problem. That's why that has to be handled. You got to have a lot of respect for, the different knowledge you're giving, and it's a level of importance. Well, the level of importance of the permanency is off the damn charts. You got to nail it. Okay. And then what's the other component of day 2 that's real important off the charts? Shifting their consciousness to third-party biomarkers. That's the biggest single concept of patient education. You can't minimize that. You got to hit a grand slam on that. You got to nail it. So some things carry way more weight than others. Those are huge. You can't screw around with that. Okay. All right. So having said that, and then you go to the mile markers, you list the mile markers relative to where they're at, tell them their importance level, and then the short story. And the importance of the story is people remember stories over data. That's the deal with a short story. And the story should only be like 3 sentences, not 5 paragraphs. Okay, we're looking to decrease the amount of words we use, not increase them. So this should all be like real simple, short, quick, and fast. That's what this should be. Not this grandiose verbiage of words spilling out ubiquitous everywhere, like the typical chiropractor that loves to hear themselves talk and explain to the patient how smart they are. No, it's not what it's about. Okay.